Hello.
One platform for news everything now we countries alone. For education, entertainment, political affairs, TV. We got enough Tanga one inside Sierra Leone, like a big quantity. We breeze not a shit.
Yes. The jingle now they pandan so. Hello, everybody. It's now na Titi Falusha. They live na the studio. TPP Leon, Mr. Komon-Tok. Na Titi Falusha dey live na the studio na in health corner. This corner ya we for take am very serious. Na corner wey everybody no for forget. Health is wealth. Well, until last week, because this month, the reason more why I choose for talk about this topic. First and foremost, I want to say hello to everybody, wherever you dey, any time of the day for the greetings. If you be say na afternoon, good morning, good evening, good night, I dey tell una all I do, and I so appreciate una who dey watch this program here. I dey appreciate una so much. I hope say una will continue for support. Do ya una not forget for go dey subscribe, and una not forget for share to other people. Tell friends of friends, families of families, now for share this idea here. It might be say not to all thing important to what you na the area, but you go pick one or two. No go be very important, yeah. All right. So as I be they say, the reason why I decide for talk about this topic, especially this month of November, because normally inside London, the month of November na prostate cancer awareness month. If una dey see boku of weight people man dey wey dey put beer, then dey na a charity wey dem make na for just let them na for raise awareness for prostate cancer. So wetin the man dem dey do, dem dey grow dem beer, they dey long. Then dey na for raise awareness. So towards this month of November, now they see boku man dem get beer, they know they shave am, then they left am for let them raise that awareness, because then self na the sickness wey dey monitor them, especially when she don reach now age 50 and above. Now the sickness wey dey monitor the man them, with the woman then na breast cancer. So hopefully, why I don't talk about this one for the man them, I know say my next topic go be the breast cancer for the woman there. How we go check yourself, then how we go able to prevent for them thing then they not cancer we. So now today I changed the way of presenting a little bit different, because today they play the video last, because based on the information why they get today, the video in they can last, because now something why one learn from the video now about exercise what they get for talk, but why they talk now the slide, so that we now go able learn what then in there, yeah, but the exercise. Okay, so today we dey talk about the early. Now just go to the slide. They said how you dey recognize early signs of prostate cancer. Although I be don't touch church all this thing, but I want go back for just touch na the top, so that Lord gets a recap before they go through run down everything. So they say how you dey recognize early signs for this prostate cancer. They say number one, you dey get difficult urinating, frequent nighttime trips to the bathroom, weak urine flow. Wetin that dey mean? When they want go wet, it dey become difficult for you. The wet not dey gree can quick. Some person they go na bathroom, they to map they close to 1-2 minutes. The wet they take time for comot. The wake na net, e dey wake na net pass almost 10 for go piece. The reason being because when the prostate don enlarge, they get pressure from the bladder, they press. So when they press on that day, they get the urge for go piss frequently. Then when you go now, some person they get the urge when you go to my back reach 2 minutes before the piss they come on. Don't it tell me about the weak flow? You know, say when the piss they come on, you forget that proper way. You know, like how water fountain they throw water. If you not get any problem with you prostate, and you not get problem with urethra, you not get problem with your bladder, the urethra and outside the tube where they send the piece so that let come outside. If you not get any problem with her, the piece if will go straight like what fountain they send water. The way they open pump no more, the pump they put the water straight. Now so if will be like a stream, they go straight. But somebody will get this problem, yeah, they become very weak. The urine flow they weak. They just come out like a dribble, small. Don't then talk about blood in urine or semen, persistent back. So then say Sunday when you go piss, they see blood. By urine or by sperm safe blood they. Then they get hip or pelvic pain. So you hip, they begin feel pain by your hip. The pelvic now, this now on by usa waist part day, we get the system what they call pelvic. We now bone them all length in and they together. The economy way they get skeleton and take them in there, they put the inside, they now hold them. The cupboard. Now pelvic. Man gets some, woman gets some. The woman they work for we more they born picking. And then now we own work than they get for we. So for this man there now all the parts they call the bladder, this all thing they just pass and then put inside the case. So now then tell we say if they experience any of these symptoms that I don't talk about, so now a very good idea for let you book your appointment. So your doctor, let your doctor go check you. As soon as I can always tell you that this body pass no more you ignore what the body they tell you. But if you not ignore the alerts what the body they tell you, me brothers them, me sisters them, if you not ignore any alerts, because the body where they well, they feel nothing, anything but you they go smooth. But as long as something begin trigger, something begin usai pain not be the pain they something begin happen to you, your body they alert you, they know. You know say something not right with me body. The only way for let prevent, let the worst not happen, you for go check you one whole body. Now, so the people tell we say they may recommend a PSA test. So this PSA test here, so they call am. Now the test what they do now ordinary blood test and they take now antigen then they go check. So the prostate antigen and they go check. Then they take a blood test, then they screen am for prostate cancer. When they go check them, then get the levels, then the number what they look for. If the number raised, it means say problem dey by you prostate. Then now then tell we number one, active surveillance. What in this mean? Active surveillance, when they don't go take your blood and don't test them, they want for do regular checkups. When be say then they do the PSA test, then they do biopsies. What in a biopsies? Biopsies, then they go take small sample by your prostate. Let them monitor the cancer closely. If it be say it don't become, they don't see say you don't develop this cancer, they don't do the PSA test, you don't tell them but this level they are they up, So then the OT then they do for let them monitor and closely if the thing they spread or not. Then they go take this small tiny tipo na the prostate and then they go pinch small thing they then carry and go na the lab. So then they now not so thing wey you eye no more they see I say oh na cancer they can do this. No, then get for look am under the microscope because then thing there how they cause this trouble all them cells there. Now something wey you know they see with your naked eyes. You know they see am with your naked eyes. Now something wey they get for put am under the microscope. Now in they see the changes that will not happen to the cells them. That 10 day if you then do am, if you don't need no immediate treatment, just regular monitoring, the doctor will tell you say, for now, what I don't see, and the results when the blood test don't count on, oh, don't do biopsy, come, you don't need treatment yet so soon. Would they just continue for monitor you regularly so that Allah will know if the thing they extend or not. That 10 day now, you get for take precaution as to waiting for do. Because something this particular thing, something and they able prevent them, but something and they not able prevent them, especially the risk factors they all been talk about when our age, genetic, you know they able. If you get for happen, it they happen. But as long as so they get breakthrough for 3 times, it okay. But what in they happen now, what they make it they okay, now early recognition. Because if you recognize an early, now they notice say na this, now they begin surveillance, the active surveillance. Of course, you they break through. Then they find all measures for make sure say either they treat you no more with medication or they treat you with surgery. We'll take me to number 2. So number 2, it tell me about surgery, what they call prostatectomy. When there's anything when they say tectomy, now something when they remove. I want to now understand. Like when they say appendicectomy. As they say sectomy, now for cut and pull am. Then they pull am. So this then they do prostatectomy. Removal of the prostate, often choosing to eliminate cancer, especially when localized. So this now for what if they don't do the surveillance, they know say the cancer it spread by you, it not allow the cells there begin go disturb other parts then you other parts of your body. The best idea for do am low removal. So then they go take her. If they live without them. Then go pull am. Yeah. So when them pull am, you self, God not help you. Although some people the recovery it is slow because we're all different. Everybody immune system different to why they react to something. But the most important thing, when they know something early and they're able to help you, now the most important thing. Done. Number 3, they say either they get something or they go do radiotherapy. I know they talk about like give somebody any option or this all. Now the doctor their own decision for what thing they want to do for you. Because I know they for cancer, they say go do surgery, go take radiotherapy. No. Me, I just give you the information. What the doctor then go then see you, then go able know what according to you prostate, what then see and by the microscope, what then do the biopsy according to that, according to that treatment, then they advise you. So the radiotherapy now, then they use now something then they use high energy rays for target the cancer cell directly. This now lights, when they say radiotherapy, now lights then they use for do this. The options, they say you get external radiation or brachytherapy radioactive seed near the tumor. Either they do an outside or they do an inside, where then they go put radioactive seed near outside the tumor, where they don't see the cancer. Done. We'll go to the next slide. Number 4, it tell we about hormone therapy, wey dey reduce the testosterone. The testosterone na levels dem wey dey help for slow down the cancer. This one na one of the hormone the woman dem get, testosterone. So dem dey use this hormone here, e dey help for slow the cancer growth, let e no multiply quick because the cells dem, some day when you get that aggressive one, e dey multiply quick. Na like e say some person dey, by the time you don't know, e don spread. Or other use for more advanced cases, like how I be dey say so, cases if other treatments aren't effective. So wetin dem mean, if other treatment, like the treatment wey we don talk about, one or two, if e don dey dem no work, na dan dey lead we for let dem can do this hormone therapy, wey dem dey use this hormone for do am. Don e tell we about number 5. This one na the common one wey boku people dem una understand am. Una dey hear about am all the time, chemo. Dem dey give am chemotherapy. All these things there wey dem dey talk about, like this chemo here, people dem can afraid am. Why dem dey afraid am? Because the treatment for am, e good, e bad. Because the chemo itself na a toxins wey dem dey go introduce na the body, wey be say if you no get strong immune system, e go hamburg the other good cells wey dey fight your body, wey na your white blood cells, wey dey can fight for you if anybody wan attack you. Na im make before ever this treatment here dem put am for you, dem dey make sure say dem raise the white blood cells dem very good, so that wey dey want if anything wan happen, then white blood cells they are ready for fight against the thing wey dey wan hamburg your immune system. So wetin dey do, they say they target fast growing cancer dem cells throughout the body. Then they often considered if hormone therapy isn't working as expected. So you don't see how then they connect them. So if the one wey dey up, na e fail for work, that number 4, when na the hormone therapy. So what then they do? Then give the option for chemotherapy. Wey be say own na for let go target the fast growing cancer cells then throughout the body, because some cell then so aggressive, then they grow quick, and na so then they multiply, then go attack all the good parts then by the good cells then. And if they attack them, like no more what so Jamaica na compound, you know say that they you know aware, and you know set trap for let you know say if you can you put the mind stay let himself for down, let you shoot them. Now so the body then cells they work. Because if you don't well prepare, you don't know, you don't recognize all them symptoms here, you know say this year they expect them, you they prepare. Then they prepare you. Now make it very important for recognize and early, so that you prepare yourself firm. Unless now, because God in time don't reach, something and they know they work for mortal man. But if in time not reach no more, now you don't recognize this thing, my brothers, this is the work. We recognize something early, they able attack them. If you then say then they can't attack it on in the news, cancel you quick, then say the soldier they plan. You said the plan. Even if they're able can, but they not go damage too much, because at least there is a plan. So now so then cells they are themselves for work towards them will make it very important for law recognize things in there early, so that we will get early help. So number 6, they call it immunotherapy. This now for boost the immune system. Like I just talk about the immune system, why they tell you now. If they boost them, so that's when they go give them medicine, like especially that chemo up there, will be saying self now that toxin, will be say Sunday, if they go the medicine for go by right, for let go kill the cancer cell what they send them for. But Sunday, if your immune system not strong for stop them, if they go kill now what they not send them for, if they go damage the good one them. So now I make then they try for give this immunotherapy for let boost the immune system, so that let target the cancer cells. So this now a specific type used for advanced See, I don't see them say prevent a specific type use for advanced prostate cancer. Then call am prevent. Then you get number 7, what they call targeted therapy. So this targeted therapy, they say they focus on specific molecules in cancer cells for precise treatment. So this one, not so for everybody. All this they come about when they don't find out, say, now this type of cancer now you get. Now they determine the type of treatment what they need for this year. What they say molecules, now some small particles them. Wey be say they na the cancer cells them. So this one I need they use for targeted and diffuse all the molecules and they let them able target the cells them. Then this particularly they say they help for cases with specific genetic changes. Don't see? It is different for everybody. Yeah. And then let's go to the next slide. We get number 8. Now this number 8 here, we dey talk about lifestyle and pain management tips. Na im I dey give una. Wetin dem tell we? This lifestyle, anything wey affect cancer, but any condition wey I don talk about all, dem always dey measure but with lifestyle. Wetin we dey put na our body, we dey eat, wetin we dey eat na our belle. E very important. Who been dey Africa, something in dey, we no be understand but this about food, the thing wey we dey eat, the impact wey e dey give na our body dem. We no dey even believe say this dey be a one whole burden for mortal man. We can't dey now. The food self wey plant eat wey dey enjoy now, e dey afraid am because the thing dem too boku, information too boku. You no know again wetin for do. But wetin we get for do? We just get for follow the advice of the landed one them. Because this life here, everybody will say the life we don't know first now you want keep because you don't know what in the next one, the next life. So this one we get for si cherish am, you want make sure say you live am good. So the lifestyle and pain management tips. It tell we about exercise. All the thing they talk about this regular exercise, you know the commodity. Some people and they like the football. When they say can't exercise, they know they do am. When you don't eat, you sit down, the body know they do nothing. Now they make the food they go, if they sit down no more, he form your own style, he go outside enough for go, outside fat enough for day, enough, he go sit down there. Because if you don't eat, now you work as you no need so they say exercise for go run. Sunday Alex self na 20-30 minutes work and now you come out now you host. You go work as small, the waka na your area, you round, you come. You don't do something for the day. You self you dey feel proud of yourself, say, why I don't eat, la no can sit down eat or la lay down. La grab first, I waka. I go down the step, I come up. But one na victim them. Something and they will don't come out do 12-hour shifts. To be honest, you can't tell me say la I can't don't step go work go the something if you are the why I don't do 12-hour shifts I can't am me host. I meet this lips not the hook. I dey suck teeth first because now I exercise. I don't exercise all day. The 12 hours I dey go up and down. I don't need no more exercise. I just want for can wasla go lay down. I can't meet step there. But I don't get choice. I get for go na me house. I get for claim am. But something and the way I don't claim am, I dey feel fine back. I say, okay, this na in close the day exercise for me. So I like na waka. People so the way see them they drive now, they're lazy. They know they use again them foot them for do nothing. Now Maggie want go buy they drive motoka. Something and they park the motoka lay waka if you so unnecessary tickets they own can go get some side and they you don't need them. Sunday, if you not lazy, some tickets they no go get them. Because in a 10-20 minutes work, I go solve the problem you come. Pass if you be say na load, boku load you want go toto. sometimes I ain't go make the problem. But it's very important. They say gentle activities like walking, see, adon candy, yoga, swimming to boost energy and reduce joint stiffness. You see what they tell we? Gentle activities then. Walking na the number one. I not be even begin talk about na the number one wey dem say. Done yoga. Some side dem dey like brothers dem old day na who get community centers there wey be say dem dey organize dem exercise there like yoga for the community. If you find out the information there, you dey able access and you no even pay for free. You dey go there, you spare your time, you go do this yoga. If you not able go for do this, all them thing they out and they talk about so yoga, e dey na TV. Then they free. Wey e be say they do am na your parlor. E dey put the TV on, e dey do am na your parlor. Don e tell we about swimming. I know say, but we Africans most of we will not sabi swim. Because we pikin dem na dem get the privilege dem na dem come to there, then they land them from school. Some of we, if you not be don grab swimming like in the road and that by force, wey dey something they apply una get water, una dey go inside there, una land, you not sabi swim, then they know. But if you want learn am, yeah, you get who dey here will get opportunity. Africa self now, people in the advance. If you able do swimming lesson, you dey able do am. Then they all they say now for just for boost to energy so that law will reduce we joint stiffness. Don they say we for eat balanced diet. They say let you prioritize fruits, veg, don lean protein, and let you reduce the intake of red meat. See una ready? You dey make fruits and vegetable as priority for your diet. Don when they call lean vegetable protein, na protein they will not get fats. Wey be say like the chicken wey they bake, they pull all the fat panel like chicken breast, for example. Now lean protein and they because you not get no fat panel. Don they say low reduce the red meat, the intake. They not say let stop or reduce. Because some person they make now, oh, I know they eat this. So the body need everything. Because for example, if now you get low blood, you na anemic patient, you anemia, when you go to the doctor back, they encourage you let eat red meat, let raise the hemoglobin. So you see, everything balance for the body, na better thing. Don it tell we about practice mind body techniques. Where then they do meditation, deep breathing, for let relax. This why who black man they difficult for do that breathing they it's man and they sabi am. But for try. For let them they say take a deep, nice breath, you do. Don't you relax. Don't then tell we about for manage the pain perception. For try pelvic floor exercise, where then they call Kegel exercise. So now that video they can play for una last, where una go watch, where una they see how the woman they demonstrate how they do that exercise. He call back cold therapy. Alternate warm and cold compress for muscle and joint pain relief. If they do cold therapy, like what do they mean? They use like some, like them footballer they sometimes and then they go, then they wash with cold water, like after when they don't play football. Now cold therapy then they help for wake the joints there. They alternate the warm and cold compress for let the muscle and the joints there. Then they act like a pain relief. Then they stay hydrated. Then say for drink enough water and limit with caffeine intake. Coffee lovers them like we, they say we for reduce caffeine intake. And caffeine not to only pan coffee, they pan other drinks them. For la make una know. Because Sunday they say, okay, me no they drink coffee. No, they pan other drink them. Caffeine they pan Lucozade, tea, some tea, then they get caffeine. So just for keep an eye on that. Yeah. And alcohol to reduce urinary symptoms. Alcohol, then they are the leading. Anything wey take pass mark na your body, dey lead to other thing. If you dey do am normal for fun, no problem, but you take am like you dey get the consumption, now e become na part of your daily activities, e dey damage you. Don dem say law try for get quality sleep. Mortal man dem recommend for law get up to 6 to 7 hours sleep for net if possible. Dem say law get good quality sleep, important. They say a good sleep routine aids recovery and the mood management connects with emotional support. Support groups or counseling, if you join this. Like normal what they say, like this, we dey talk about this past Saturday with my sisters. They all been get one occasion. We go do a anniversary with me connected sisters. They will be talk about them thing there. We be say this country will get a lot. Even then thing there what they mention. So if you know God not help you now, you go through all this problem here. You get prostate cancer. So until you not get family now, all thing. If you not get social connection, it they become depressed. Now they make people that they get boku mental health issues them. Now this come for various reasons them. Where you don't sick, so until you not get safe party, good party where they go fend you. Now you no more in the hospital, people there where they support you. Whose time when they get for sit and keep company with you, then they pan the work with them busy. But if you get this support group or you get counseling, reduce isolation and build coping skills, you see, now they will arrive so. It's very important. It's very, very important for do so. Don, it tell we these signs and symptoms them I just want go over for long now understand for increased frequency, needing to urinate. You see, I then say now the key points in this will be covered. We'll talk about the increased frequency where they need for go wet fast more than usual, where they get the urgency, sudden and urgent, and the need for urinate, and they wake na net like I be they say, don't need they hesitate for delay where they start for go wet. Don't pour urinary stream, that flow I be they talk about, and terminal dribbling, where some person they don't piss down, until you don't wear the trousers. So until you in a public, you go, the piece begin leak by you. It's shameful. You they feel shy. All that thing and they result you for isolation. Especially this because you they feel say enough for the among side group of people and they so until you they smell peace, people learn and not think about that of that thing and they feeling of incomplete emptying of your bladder. Done urinary retention where you know they able piece again, pass them go put catheter for you. And then they make man get low self-esteem, especially when they go put catheter in general, when they put some for you, they shame. Because for let person they see you bag, you piece they give you low self-esteem. All them thing there, they result to mental health issue, they depress. Paddy ben go fend you, they shame, even if you get paddy now, go fend you. You know go and let see you inside that catheter day. They feel but if you na person who don't deal with you, now the only person who they able to go support you during them time then they the time of need. So it's very important for law pay attention to them here. This why I adjust and tell me about the percentage of the cases there where they don't diagnose inside UK. Men in the UK, 40,000 new cases them. Can you imagine? Can you imagine? So when they appear, they say Sunday when symptoms do appear, they are usually due to enlarged prostate affecting the urethra. Now that's when they know say the prostate don't big. Now that's when the symptoms then they begin by you. Though the common symptoms then they say the increase the need. That over and over no more. Now the common symptoms they are always and they talk about how urinate, especially at night, where they disrupt your sleep, where they make you they become tired, and it is difficult for let you start or stop for peace. All them thing there, now they don't tell we. And now, all this, it they go no more on and on. They slide there all day na the websites, na the YouTube. Do ya una go there, na the familiarize una self. Especially this month, me papa, me uncle, and me brother, this na prostate cancer awareness. Prostate awareness this month here, yeah, na prostate awareness. So do ya una go, let una refresh una memories them, let una know what una do. Now, I just can't left una, let I play the video for this exercise. I know say today we run time a little bit because we need for cover this. So they can play the video for the woman who they can advise we about the exercise, yeah? Okay.
Hi, I'm Michelle, and today I'm going to guide you through pelvic floor muscle training to stop bladder leakage after prostate surgery. Now, some of this training information is based on a recent research article, and it's linked in the description below if you'd like to access it. Now, the authors really emphasise the importance of individualised treatment, so please consult with a pelvic floor physiotherapist for your post-op management if you're able to. Now, today we're going to cover when and where to start your pelvic floor exercises, also how to do your pelvic floor exercises when you're starting out after surgery, 2 ways to test your exercises, and also how many exercises you need to do to get good results. Now, you can usually start your pelvic floor training with your surgeon's approval, and this is after your catheter's been removed. It's also very beneficial for bladder control if you can start this pelvic floor training before your surgery. Now, you can start your exercises in any one of the following positions: lying down with your feet flat and your knees bent, over a couple of pillows if you can, or semi-reclined, perhaps in a reclined lounge, or standing upright, particularly if you're familiar with standing pelvic floor exercises and pelvic floor training. Now, if you're currently troubled by leakage, then I really recommend doing your exercises reclined for the first 2 or 3 weeks. Now, let's go through how to do your pelvic floor exercises for bladder control. If we review your pelvic floor muscles, you'll be exercising these muscles during your pelvic training. Your pelvic floor muscles are in and around the area where you sit, as you can see here. Some of the muscles we're focusing on for your bladder control sit at the base of your penis, and they wrap around the base of the penis, along with a muscle that sits deeper inside around your urine tube. Here's how to exercise these muscles to stop bladder leakage. There's 2 parts to doing this exercise correctly. We're going to do each part separately, and then we're going to put them both together. Now, the first part of your exercise involves shortening your penis or drawing it inwards, similar to the way a turtle would pull its head back into its shell. Start by relaxing your breathing. Relax your buttocks and your belly. Now breathe in, and as you breathe out, gently shorten your penis by drawing it inwards towards your body. And now relax. Let's repeat the same exercise again, keeping it gentle, and see if you can do this for 2 to 3 seconds if you're able to. If you're having trouble, try to imagine the action of peeing upwards on the wall. All right, start now, breathe in, and now as you breathe out, shorten your penis for 1 and 2, and now relax. How did you go using this technique? Please try not to worry if this seems challenging at first, because this exercise can really take some time to learn. Now, here's the second part of this exercise. This time I want you to try to contract as if you're gently stopping the flow of urine or just slowing it down a little. Start with your relaxed breathing, relaxing your thighs, your buttocks and your belly. Here we go, breathe in, and as you breathe out, gently contract your muscles as if you're trying to stop the flow. Try to keep contracting for another second or 2, breathing throughout if you can, and now take a rest. All right, we've done the 2 parts. Now let's put parts 1 and 2 together, and this is the correct action for your pelvic floor training. Now don't forget, at the start this needs to be really gentle. Just focus on really good quality and good form rather than contracting strongly. That can come later on. All right, let's start now. Breathe in, and as you breathe out, just gently stop the flow of urine and shorten the penis. Try to keep breathing and hold your muscles contracted for 1 and 2, and now relax right back to resting. Now this is the correct exercise for you to practice, shortening the penis and stopping the flow at the same time. So remember the key points are to try to breathe normally and to keep your upper belly relaxed throughout the exercises. Now, there's a couple of good ways to know and to test whether you're doing these exercises correctly, because sometimes it's just hard to know. You can test by trying to stop or slow the flow of urine, but you do this just once a week and as a test, not an exercise, just to see if you're using the correct muscles. The other way to test is to stand side onto a mirror. When you use the correct technique, if you're standing side on, you can see your penis move slightly inwards towards your body. Now, how many exercises to start with? This is a big question. I want you to try to start out with 2 to 3 second holds, so they're only a couple of seconds. Repeat these exercises just gently, doing the number of exercises you can manage, up to say 5 or even 10 times in a row if you can do that many. Try and do this routine 2 to 3 times a day. To progress these exercises over the next 2 to 3 weeks, try to hold your exercises for up to 10 seconds and repeat them up to 10 times in a row if you can. But remember, just do what you can manage using really good technique. Remember that it can take a number of weeks to improve your bladder control through exercise. The key is regular practice and progressing your training as your strength improves. I hope this information is helpful for your recovery. I'd really appreciate it if you can give this video the thumbs up if this video helps you. So if you'd like to see more pelvic floor training for bladder control, or if you have any questions, please let me know in the comments below. Thanks so much for watching today. I'll see you next time.
Okay. All right, me family. Until we don't see the video, this video, it is na the YouTube channel, yeah? So anybody, if you want follow wetin the woman they talk, where then they do this pelvic floor exercise, even me, now why they do this research for la able present this in, I know say man they do a move. I get for be honest. Because always pelvic floor exercise we they think say na for we the woman them. Because we self as a midwife, where we don't do the woman that we don't born picky, like oh they discharge them for go home, we can always advise them on pelvic floor exercise, because you know say woman don't get belly, all the muscle they don't weak. So pelvic floor exercise they help and for it bring the muscle them back together. We they teach them that day. But me self learn from this for sure say man them back, they do pelvic floor exercise after they don't go through treatment of their prostate cancer. So it's very important for long go na the YouTube channel Mr. Komon-Tok, so that long na able for go familiarize with this video, yeah, let you dey practice wetin for do, yeah, because if you able do and not to pass you get the prostate. So because wetin this thing they do for you, if your bladder don't start for week, you dey able use this exercise for do am. Let's strengthen the muscle of your bladder there. Not to pass no more, you don't do the surgery or this. No. Pelvic floor exercise, nati, especially when you don't age. Woman no, man no, who forgot they do am. Nati way they do, you can sit down so safe, you go greet person, they do am, they know. You dey do am within yourself, because na for later you dey hold yourself like for 10 seconds, then you release your muscle them. If you don't sabi how for do am, you go dey do am, you know they even notice say you dey pan do am. Yeah. So today I tell you now all thank you for watch. Although we go over the time, but na very vital information. I be need for give this information. Now I make I tell you now thank you. I just want to go through the comment section. Let's see the people who don't send comments. And una not forget like what they say. Do ya. If you know anything for improve this channel, una send me message. Una send message, we go see to wetin you want for improve, and anything or evaluation they panel for improve. If find criticism, if you get for accept if they do something. If you know they do something or no good, if you then criticize, now they help you, you then want to say way out for do and because na for una they do this. Do ya, let una tell we. Yeah? Okay. So let's see the people them who don't send comments. Okay. God bless you, my sister. Mr. Kelvin say you na me big fan. You always there for tell me thank you. You say I tell you thank you. I tell you thank you as well, yeah. Don't forget Mr. Hab. TPP, you are the best. They say TPP, you are the best. You are so experienced in the game of TV show and presentation. It doesn't necessarily has to be political issues all the time. Thanks for the consultation and education. Thank you so much, Mr. Ab. Thank you so Alaji Hi Kanu. Thank you. I thank una so much. Una continue for go na this comment section and now una dey put una comments them. We appreciate una so much, and because without una, we no go sit there and give this info. And this information, I go always try my best for like give una any information what I get, because then just they say if you go now you learn something, you get for benefit your community, benefit your people them either way. It might be say this information will save 1 or 2 lives, but as long as that happen, I know say I don't give back to my community. Thank you so much. I love una all. I left una. So hopefully by next week we will try for can talk, but we the woman then we own a breast cancer. Thank you so much. So mama them breast cancer, then say even man then they get a move. No, not forget. We will cancel that theory day. I thank una so much. I go left una for starter.